Good morning, everyone. Thank you so much for joining me today. My name is Dr. Adaeze Ifezulike. A lot of you may already know me. I'm based in Aberdeen, UK. So I'm joining us today because this is Mental Health Awareness Week. And in the UK, between May 13th and the 19th, we talk about mental health and raise awareness. So this year's theme is body image, how we think and feel about our bodies. You will agree with me that that's such an important topic because lots of people are distressed with how they look, how they feel about their bodies and so on. It can cause a lot of mental health stress. So we'll be tackling all that today. So stay tuned, please share the video, let other people know. Let's raise awareness concerning mental health. So the WHO, the World Health Organization, says that 1 in 4 of us have mental health problems. That means that wherever you're listening to me from, if there are 3 other people there, it means that at least one of you is going through a lot of mental problems. So this is really important. Now, the troubling thing is that 2/3 of the people who have a mental health problem do not come forward to get any treatment. They live with their problems. That is really unfortunate because there can be help, there can be treatment available. And so we want to look at the reasons why people don't come forward. And one of the reasons is stigma. Mental health is still being stigmatized. So people feel ashamed to admit to having mental health problems. We want to stop the stigma. Mental health issues are just the same as any other health problem. Just like if you had diabetes or hypertension, you wouldn't be ashamed to come forward and get help. So I want to encourage people with mental health problems, please seek help. There's help available. Okay, so there are lots of different types of mental health problems. There can be mood problems like depression, which is a common one. So mood disorders, problems with personality disorders, stress, mental stress from traumatic incidences in the person's past, what we call post-traumatic stress disorder. There can be mental health from use of illicit substances like alcohol, using alcohol excessively, or things like cocaine, heroin, and so on. So all that can bring about mental health problems. So there are lots of different ones. The common health problem, however, we find is depression. So we'll talk briefly about depression. What is depression? Depression is a situation where an individual has overwhelmingly a sense of sadness. So sadness is their main feeling, and this can go on most times of the day for up to 2 weeks or more. And then we say the person has depression. There can be other features of depression. The person may notice that they have no interest in the things that usually give them pleasure, in the things that they usually enjoy. They no longer have interest in those pleasurable activities. The individual may find that they feel sluggish, like they're moving in slow motion. They can't seem to work themselves up to do what they usually do. There's no motivation. They may sleep a lot, or they may sleep too little. You might find that you wake up in the early hours of the morning and you just can't go back to bed. So depression is a major health problem, and it can be very debilitating. And for a lot of people, they do tend to get suicidal thoughts. They begin to feel, I'm better off not being here. I should do away with myself. That is a very dark place to be in, very sad indeed. And that's why we do these things, to create awareness and encourage people not to get to that state. And if you're even at that state, to look at ways in which you can help yourself. Okay, so one of the things we'll be looking at today are thought patterns, our thought patterns, because research shows that the way we think can actually affect our mental health. I want us to bear a few things in mind concerning our thoughts, okay? The first thing to bear in mind is that our thoughts are suggestions, they are not facts. So when a thought comes to your mind, it does not necessarily mean it's true. It's just your mind suggesting something to you. Don't treat it as gospel truth. Okay. The next thing to bear in mind is that thoughts can impact our mood, stress levels, and make us anxious. The thoughts we think can actually get us all anxious and worried. Another thing is that thoughts can be negative and unhelpful. Unhelpful. That's a really important concept. You see, something might happen and you react in a normal way. Your normal reaction, what somebody would consider normal because of what has happened. However, when you look at your mental health, it's important to differentiate between a normal reaction and an unhelpful reaction. So your reaction may be normal, but is it helpful? Is your reaction helpful? How is it going to help the situation? So thoughts can be negative and unhelpful. And bear in mind that you're more likely to think more unhelpful thoughts if you're tired, hungry, or physically ill. So it's really important when you're tired, when you're hungry, when you're physically ill, don't accept every thought that comes to you. That is really an important time to question your thoughts. Do not take them as gospel truths or make decisions at that time, because you're likely to find that those decisions were not right. Okay. So let's look at thought patterns that keep us unhappy, thought patterns that affect our mental health. The first thought pattern I want to talk about is catastrophizing. Some of you may have heard about it. What is catastrophizing? It's a situation, a thinking pattern where we always expect the worst case scenario. We always expect that things will go wrong. A young girl came to me, remember it's all about body image, and she said, oh, I've got this spot on my face and it's growing bigger. I think it's a cancer. Oh, I'm going to die. You see how her thoughts have gotten her so worked up. She's looking at the worst case scenario. Because of a spot on her face, she's thinking she's going to die. Are you like that? Do you tend to catastrophize? That might be keeping you ill. Another thought pattern I want us to look at is emotional reasoning. This sort of thought pattern is where we base our judgments based on how we feel. Our feelings become our guide. I feel unhappy, therefore I am unhappy. Our feelings become what we rely on to make our decisions. Someone could say, I feel ugly. Someone is feeling ugly. That means I am ugly. But that we know that doesn't follow. The fact that you're feeling ugly doesn't necessarily mean that you are ugly. We assume that because we feel this way, what we think must be right. Let's beware of emotional reasoning. You see, there's a part of us that is prone to think in an emotional way. We have the emotional mind, we have the logical mind. The emotional mind just bases on how it feels. Okay? You wake up one morning and you feel sad. The emotional mind is not rational. It doesn't always have to have a reason for the way it's feeling. And therefore, we cannot go by it because it's so changeable. The next minute you might be feeling happy. It's changed again. You understand? So let's base our thoughts, our judgments on actual facts, on logic, rather than emotions. Okay, so the next thought pattern I want us to look at, which can also cause a lot of mental stress, is minimizing. Minimizing. What do I mean by that? It's a thought pattern where you never see anything you do as being important. No matter how good, no matter how well you have done, you minimize it. However, you like to maximize other people's strengths. So you minimize your own strengths, but you maximize other people's strengths. Now, that can make it really difficult for you to accept compliments. Someone may say to you, oh, I love this dress you're wearing. Instead of saying thank you with a smile and being happy, you say, oh, that old dress. Actually, I bought it from a charity shop. You see, you're minimizing the compliment instead of taking it on. Now, the challenge with that is that you never then have a reason to celebrate yourself. You always look upon your weaknesses, you magnify them, you focus on them, and you keep yourself unhappy. So that is a thought pattern we need to change to help our mental health. Okay, I've seen Teenagers, for example, focus on the one person who doesn't seem to be so friendly with them. And then they forget that they have loads of other friends. One person that is not friendly with you does not mean that you're not a nice person. So let's focus on the things that are working. Let's maximize our strengths. Another thought pattern that affects our mental health is jumping to conclusion. I have an example here that John didn't invite me to be his prom partner. Therefore, he must hate me. When we jump to conclusion, we've only got maybe one piece of information, and then our minds then make up the rest of the story. So we're basing the story on just one piece of information, which may or may not be right. And the rest of the story, our minds then make it up. We jump to conclusion. When we behave in that way, when we think that way, we're fortune telling. We're acting like fortune tellers or mind readers. Maybe you're in a relationship and your partner, for some reason, didn't smile at you the way he normally would. And you then begin to mind read. Oh, he doesn't like me. Oh, I must be looking ugly today. Oh, you're now jumping to conclusion. That is a type of thinking pattern that is so damaging to our mental health. It's important to clarify with people. If you're not sure what they mean, don't jump to conclusion. Actually take a moment to clarify with them. So our next thought pattern we want to look at is personalization. This is a really damaging one. What do we mean? There's a thought pattern where you assume that everything that goes wrong is your fault. And you then don't believe that others have contributed to make the situation worse. You blame yourself for everything, even things that are out of your control, things that you had no hand in, but you take it up on yourself. That is a mental health problem. When you personalize everything, even events that occur in the world that you had no hand in, you have no control over, you just feel somehow it's my fault. On the other hand, you can also push it onto other people. Things that are not within their control, you blame them, you feel it's their fault. So personalization, very important to check yourself if you have this thought pattern, because it might be affecting your mental health, affecting your relationships, and making life really difficult for you. Another thinking pattern I want to look at is negative self-labeling. Labeling. Human beings, we love to label things. This is hot. This is cold. He is wicked. She is an angry person. We label. Let's check ourselves. If you think this way, you might find that you think everybody around you is your enemy because you want to put a label on them. It's damaging. We label ourselves based on mistakes we make or even imagine we have made. For example, you drop you drop your cup, your teacup, and then you label yourself clumsy. I'm clumsy. Oh, I'm always clumsy. You make a mistake, you fail an exam, you label yourself failure. I'm a failure. We love to label, but this is so damaging, not just to ourselves, but in relationships. Labeling people based on one mistake they have made. Let's check that pattern of thinking because it affects our mental health. Okay? Teenagers may label themselves ugly simply based on the fact that they have spots on their face, or ugly based on the fact that they think they have a big nose. And that's why this year's mental health awareness is all about body image. What part of you do you not feel is so perfect, and because of it you've labeled yourself ugly? Is there really truth in that? So another thought pattern we want to look at is all or nothing thinking. This is a huge one. This is looking at things in black or white categories. This thing is either white or it is black. For you, there's no middle ground. But this is a childish way of thinking because life just isn't that way. Some people are not all bad and some people all good. Often a mixture of different things. Okay? There are often middle grounds that are acceptable too. All or none thinking can be things like, I have to be perfect all the time, otherwise I'm a failure. That can keep you miserable. Of course, you don't have to be perfect. You don't have to look perfect all the time. There are times when you're tired. You don't want to go to all the trouble to look perfect. There are times when it's okay to just be comfortable in yourself. Okay, so all or none thinking can affect a relationship. We may be expecting our partners to be perfect, or we get a divorce. It doesn't work that way. There are often middle grounds that we can still find tolerable and work in harmony with. Another thought pattern I want to talk about today is overgeneralization. Generalizing from a single negative experience. For example, the last time I tried to lose weight, I didn't succeed. Therefore, I'm going to be overweight all my life. Is that really true? Perhaps the last time the technique you used didn't work, wasn't the right one for you. Do not generalize from one failed attempt that you will never then succeed. And this is common with young people too. Young people often generalize. Oh, nobody asked me to go to prom with them, therefore I'm going to be single all my life. You know, they just extrapolate from one incident and use that to generalize. But we know it doesn't work that way, okay? Another thought pattern I want to look at is magnification. In this damaging thought pattern, we focus on the negative aspects while overlooking the positive aspects of our bodies. We feel overwhelmed by the one aspect of our physique that isn't quite our best, whereas we have so many other good points. Perhaps you don't have the best of hands, but you've got lovely legs that are healthy and strong and carry you everywhere you go. That's something to focus on. Perhaps you don't have perfect hair, but you've got good skin. Why don't you focus on that? In magnification, we find ourselves magnifying the wrong parts or the parts that we feel are not perfect. And we overlook the fact that we have other really beautiful aspects of ourselves. Do you practice magnification? It might be a thought pattern that is affecting your mental health. Another thought pattern I want to look at is should or should not thinking. In this pattern, we make strict rules and then beat up ourselves when we can't meet up. For example, you could say things like, I should always get along with my spouse. I should always, I must always. So must, should, things like that. You're putting up rules that are quite high. When you then don't meet up, you feel like a failure. You begin to feel, oh, I failed, you know. But we know it doesn't always happen that you get along with your spouse. If you think in a should manner, you then feel hopeless when you don't meet up. And you tend to over-criticize and become a perfectionist. You keep finding faults in people because in your mind you've put rules about them. Oh, they should be perfect. Oh, they should do this. Oh, they should always do this. But when we change the way we look at things, instead of should, could we change it to could? Yeah? I'll try my best. I could do better in this. Rather than should, rather than putting strict laws on ourselves that we then find that we can't meet up and then we feel like failures. So we have looked at thought patterns that can harm our mental health. So what do we do to change these thinking patterns, these harmful thinking patterns? Remember we said earlier, first point to remember is that thoughts are suggestions from the mind. They are not necessarily facts. Don't treat them as gospel truths. Don't treat your thoughts as gospel truths. Question them. Okay? So I want to encourage us to question or challenge our thoughts. Challenge them using this question. And a good resource for this is Mood Juice. If you go to www.moodjuice, MOODJUICE, Mood Juice. It's a good resource for mental health. So let's look at some of the questions you can use to question or challenge the thoughts that are keeping you unhappy. Number one, where is evidence for my belief? Would friends agree with this belief, or is it just in my head? Would a scientist agree with this belief? So first step is asking yourself, what is the evidence for this way I am thinking? Someone may have said to you many years ago that, oh, you're ugly. Now, where is the evidence that you're ugly? Who else has said that? Is it just that one person out of the billions of people on this earth? What is the evidence for the way you are thinking that is keeping you unhappy? Would somebody else agree with that? If you were in a court of law and you said, oh, I'm ugly because this person said that, would that stand up to the judge? Do you think the judge will agree, yes, you are ugly based on this evidence? So you need to question your beliefs that are keeping you unhappy, okay? Another question is, can I identify any of the unhelpful thought patterns mentioned? So now we've talked about thought patterns. We've talked about catastrophizing, all or nothing thinking. We've talked about magnification, minimizing, all those thought patterns. So now when a thought comes to your mind, can you ask yourself, oh, I recognize that thought pattern. Am I making a mountain out of a molehill? Actually trying to see your thinking pattern, is it an unhelpful one? That can be so important. Another question is, am I distressing myself over the way I think things should be rather than dealing with them the way they are? Am I getting all worked up because I think things should be in a particular way? My marriage should be in this way. My appearance should be in this way. My face should look this way. My shape should look this way. All those should statements, we've said they can be very damaging to your mental health. It's best to deal with things as they are rather than should or must, because that sets us up for failure. Okay, so another question is, what would I say to a friend who had this thought in a similar situation? If my friend made the same mistake I have made, what will I tell them? So put yourself in that situation where it's your friend who is experiencing what you're experiencing. I'm sure you say to your friend, oh, don't worry, it's going to be fine. Stop worrying. It's no big deal. So can you say that to yourself? Why don't you be that friend to yourself? That's part of taking care of your mental health. Okay. Number 5, how would I feel about this in 6 months' time? The time factor. That thing that looks so terrible. Oh, this person wrote something about me on Facebook. I'm finished. Young people, they feel things so strongly. Oh, my friend wrote this about me in Facebook or Instagram. In the next 6 months, would that be important? You find that it's nothing at all. A lot of my colleagues failed exams in medical school. But today they are doctors. That one failure, looking back now, it was no big deal. But when it happened to them, they felt it was like the end of the world. So that thing that's troubling your heart, ask yourself, in the next 6 months, would this be important at all? Another question is this way of thinking making me happier or sadder? Or is it getting me to my goals? The way I am thinking now, is it making me happier or sadder? The way I am thinking now, is it getting me to my goals? Is it helping me to achieve my potential? If the answer is no, then you need to question that belief. Why do I have it in my life? Who did I hear it from? Why should I believe it when it's making me sad? When it's making me unhappy? When it's not allowing me get to my goals? So question your beliefs. Find out how they're making you feel and decide whether you want them or not. Another question is, am I labeling myself or someone else? And is that a fair thing to do? You failed one exam, you label yourself failure. Is that really fair based on one failed exam? Someone made a mistake, they said something about you that wasn't nice. Does that make them a gossip forever? You label them gossip because of one mistake. And so we go around labeling people. Ask yourself, this label I am putting on this person, is it really fair based on just this one thing they have done? Another question is, just because this problem has occurred, does that mean I am a failure or useless or hopeless? Does that mean he or she is useless? Just because your spouse did something and lost his job, does that make him useless? Just because a friend didn't turn up on time for your appointment, does that make him not a good person? Just because someone didn't smile at you, does that make them unfriendly? One incident. Okay, so let's check that. Another question is, am I taking things too personally? Am I taking things too personally? A lot of us are emotional thinkers. So when something is said, we immediately assume they're saying it because of us. We immediately feel, oh, they're attacking me. It's me they're talking about. Oh, they hate me. Everybody hates me. You know, we go around feeling that way, always ready to take offense, always ready to be offended. Am I taking things too personally? A very important question to ask yourself. Okay, if you're just joining the video, please look back at the beginning. It's really important to get the thought patterns we talked about. That will help you understand these questionings. Okay, now next one is, am I blaming others unfairly just to make myself feel better? Sometimes we blame other people, but that's because we're angry. You know, we're upset. So all that energy, negative energy in us, we want to release it. And sometimes we spill it all over somebody else. You know, are we doing that just to relieve ourselves? Meanwhile, the person doesn't deserve it. So, questions to ask yourself. This thing I'm doing, I'm writing this text. This person has annoyed me. So I'm going to respond. I'm so angry. I'm going to respond in this text, respond angrily. So you're going to respond angrily so that you feel better. But does the person actually deserve that? Taking a moment to stop and say to yourself, what's the real reason I'm doing this? Is it because I want to discharge this pent-up negative emotion in me? Is this the best way to discharge it? Is this the best way to let it out by pouring my anger all over my spouse or my children or my friend? Is this the best way to do it? So you can see how these questions can powerfully shine the light on that unhelpful thought pattern and rob it of its power to drain your emotional health. When we challenge these thoughts that come to us, it drains them of their emotional power. Okay? Just bringing awareness into your manner of thinking can be so liberating. Don't just think. Bring some awareness into the way you're thinking. Pause for a moment and ask yourself, am I personalizing this? Am I making a mountain out of a molehill? If I presented this in a court of law, would it stand up as evidence? That can be so liberating. Bringing awareness into the way you think. Okay? Realizing that, oh, I tend to make a mountain out of a molehill because of my catastrophizing manner of thinking. This can help you manage relationships better. Okay. Oftentimes, a lot of things can be overlooked. It's all about choosing your battles. There are some minor things that are not even what's your energy on. You know, best to just pass them by for your mental health. Your spouse has done something, it's not life-threatening, it's not, in the next 6 months you will look back and wonder what that was about. Can you let go? Or are you going to turn that molehill into a mountain? Are you going to catastrophize? He did this, therefore, oh, we must get a divorce. It's looking carefully, making sure that you're not being an emotional thinker who just makes decisions based on how they're feeling in the heat of the moment. Okay, so learn to sound your thoughts out on paper. Very important. Write down the way you're feeling. Or sound it out to a trusted person, a doctor or a counselor. They can help you see that it's an unhelpful and illogical thought. By the time you write it out on paper, you know, that's a way of pouring out that pent-up emotion. Put it on paper, okay? And then read through it. Get somebody else to read through it. Speak to somebody. You may suddenly find that actually that's an illogical reasoning, illogical conclusion you've arrived at. Okay, so self-awareness is the key to mental well-being. Self-awareness. Noticing what your mind is doing and seeking help early before things deteriorate. Let the people, your loved ones around you, know what triggers your mental health problems and teach them to help you find help soon rather than later. Okay, let those who are closest to you, if you've been medicalized, if you're on medication for your mental health, or you've had crisis moments where you've had to be sectioned. So sectioning is a situation where you now have to be forcibly taken to hospital. It's important to discuss with your loved ones. These are my triggers. If you see me behaving like this, please help me get help early, because when you're in the heat of the moment, you may not be able to make the right decisions for your mental health. So another thing to do is getting plenty of fresh fruits and vegetables. Avoid processed, sugary, salty food. Those harm your body, and if your body is not physically sound, it makes it even harder to cope with mental stress. Things that you could easily cope with if you are in the best physical state, you might find it harder to cope with simply because your body is tired, you've not had enough sleep, or you've been eating unhealthy food. Okay? Getting lots of exercise, go out, get some fresh air, really important. Avoid being sedentary. Try and get in some exercise. Even if it's a brisk walk, 30 minutes every day, or even 5 times a week. When you exercise, you're releasing natural hormones that improve your well-being. You know, when the body releases 2 different kinds of hormones, there can be hormones associated with feeling stressed, stress hormones like cortisol, adrenaline. However, there are also nice hormones, feel-good hormones that can be released too if you're relaxed and stressless. So which one do you want? The stress hormones, when they are released, they can lead to other health problems like digestive problems. When you're stressed, digestion is shut off because it's not a priority when you're stressed. So you're not digesting things properly. People then have things like irritable bowel. Stress hormones can lead to headaches, to migraines, to high blood pressure, to palpitations. Your heart palpitates, making you feel really uncomfortable. To breathing problems, you feel you can't get breath, and so on. So which would we rather have? Stress hormones or helpful hormones that help us feel beautiful, feel relaxed, help our bowels function well, help our thinking, our focus to be sharpened, so we'll do things better. So, how does a thought make you feel? Very important question. Do you want to feel that way? If the answer is no, then the thought is not from the real you. Do not take it on. I can't emphasize enough that the thoughts that come to us are suggestions. They are not orders. You don't have to take them on. How is the thought making you feel? If you don't feel right, it's making you feel unhappy, making you feel ugly, depressed, then don't accept the thought. It's just a suggestion. It's not the real you. Okay, so beware how other people's suggestions can damage your mental health. Beware. We've talked about thoughts from ourselves, which are just suggestions. But you can also have thoughts from others coming into you. Again, they're suggestions. You don't have to take them on if they're going to harm your mental health. And I'll give us an example. One day I was at work. It was my break time. So I was having a cup of tea, relaxing. And then the coordinator came in and said, "Oh, there's a patient waiting. You need to come quick, 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 quick." So I said, "Okay, I'll be right there." So he left. He's a dear friend of mine. We get along so well, no issues at all. But after he left, the other doctor that was there said to me, "Oh, he spoke really rudely to you." And I was a bit taken aback because I hadn't thought of it that way at all. Like I said, the coordinator is my friend, so I wasn't offended in the least bit. We get along. But when this other person said, "Oh, he was really rude to you. He shouldn't have spoken to you like that," a part of me thought, that's true. He was really rude. Shouldn't speak to me like that. I should be offended. I should get mad. And then I stopped myself. I said, no, the real me is not offended. I'm not offended. I know he meant no harm. I will not take on this suggestion of offense. I won't take it on. So beware how other people's suggestions can damage your mental health, can make you make decisions that you know deep in your heart that's not what you want to do.